So there are times when the patient has a really complicated turn. Maybe they don't tolerate it very well being fully turned to a 30-degree angle. You want to make sure you try and see if you can get the patient comfortable. If you are still unsuccessful, then we can move to a few other alternatives. One would be to bring the wedge out so they're not turned as much. It's not ideal, but it's better than nothing. So that's one option. The other option would be to set 2 wedges, one from each side. So you could, can you turn onto your side that way for me? So you would set one this way. Okay, come on back. And then what we're gonna have you do is turn the patient, bend the leg if you need to. And then we're gonna turn and bring your arms over. And you're gonna tuck this one under as well. Try to make it so they meet together so that they're at the same level. So you can see here, these two are at the same level. And if you have a bed that does not have the tilt feature, then you just need to get extra help to manually turn the patient. But what this will do is this will put the coccyx and buttocks area in the curvature of the 2 pillows. So you haven't fully offloaded the weight, but you have lessened the weight on their buttocks. If your patient is in the ICU, something you might see there is continuous lateral rotation, and that's where the bed is doing the work of turning side to side. Putting a wedge under both sides would be imperative, because when you have that lateral rotation, you can get some friction and shearing injury simply by the weight going from one side to the other as the bed shifts its weight and it turns the patient. If you put these under the patient, it will prevent the friction and shearing and stop the sliding of the patient back from side to side. To show you what I'm going to do is just do a quick tilt of the bed so you can see what I'm referring to. Typically the patient will start to slide this way, but as you can see, the bed is holding firmly the patient in position. So the patient is now turned, but they're not physically sliding towards the side of the bed. Is that good?
Now we got...
If you still need to get a patient in the high Fowler's position and you're struggling, another option would be to take this wedge pillow. You're going to put it under the patient's knees and get it as close up to the peri area as possible. That way, when the patient is sitting upright, because of the anti-skid on the bottom, they're not going to be sliding down the back. So that when the patient comes up into a sitting position, they'll be practically sitting on this pillow and not sliding. The other thing you want to do is take a pillow when the patient is fully upright and slide it down lengthwise down their back to get them better supported sitting upright, which I will demonstrate. Oh, that's pretty good.
This is genius. This is.
Yeah.
Yes.